For my presentation, I compared the U.S. to Canada and Germany in healthcare coverage, disease management, and prescription medication use and spending. Healthcare coverage includes what is spent per capita on healthcare, as well as the type of coverage that is offered. In this slide looking at healthcare coverage, it compares the health insurance coverage that is offered by the United States, Canada, and Germany. The U.S. does not have a single nationwide system of healthcare coverage. You either purchase healthcare coverage in the private market or it is provided by the government-funded program to certain populations. In the private market, you can purchase either conventional or traditional insurance coverage. The conventional insurance coverage allows you to choose your own doctor, but there are plans that have some type of utilization management program, such as pre-admission certification, mandatory second opinion for surgery, or limits on the time you can spend in the hospital based on your diagnosis. The traditional insurance coverage that is offered depends on what type of medical services you are seeking, as well as the copay and deductible amounts that you are looking for. There are two types of government-funded insurance programs. Those are Medicare and Medicaid. Medicare is offered to those that are disabled or meet certain age criterion and fully administered by the government. Medicaid provides coverage for certain economically disadvantaged citizens. Medicaid is funded by the federal and state governments, but it is administered by each state government. There is a large percentage of the population in the U.S. that lack health insurance or are underinsured. Canada has universal health care coverage for its citizens. The universal health care coverage is funded by general taxes, and one party is responsible for paying health care providers for their claims. The companies that people have to pay are negligible depending on the service, and they have their choice of physicians. Each province offers their own version of a health care plan, and it is administered within that province and provides comprehensive first dollar coverage for medically necessary services. Healthcare coverage is provided to all residents with no out-of-pocket expenses, but there are those exceptions. Private healthcare coverage is illegal in Canada, but there are supplemental insurance plans available to cover prescription medications and dental services. Germany requires by law that all individuals have health insurance. There are sickness funds available to those that earn less than a certain amount per year. The sickness funds are required by law to provide comprehensive benefits that include ambulatory care provided by physicians in private practice, hospital care, home nursing care, preventative services, and visits to health spas. The patient share of the cost is minimal in these instances. Those in the sickness funds can also purchase private supplementary insurance to cover copays and other items. These funds even provide additional cash payments to those who are unemployed as a result of an illness. Private insurance is offered to those that earn more than that income limit, but most voluntarily join a sickness fund. The premiums for health care are calculated based on income and not on age or the number of dependents you have. The premiums are collected through a payroll tax deduction. Under the healthcare coverage heading, I looked at total health spending for the United States, Canada, and Germany compared to the OECD countries that they compared data to. The U.S. spends $9,086 per capita based on 2013 data. Of that $9,086, $1,074 was spent on out-of-pocket expenses. $3,442 was spent on the private side, and $4,197 was spent on the public side. The percentage of the gross domestic product for healthcare spending was 17.1%. For Canada, the per capita spending based on 2013 data was $4,569 per person. Of that, $623 was for out-of-pocket expenses, $654 was on the private side, and $3,074 per person was on the public side, which equates to 10.7% of the gross domestic product spent on healthcare. For Germany, based on 2013 data, $4,920 was spent per person for health care coverage. Of that, $649 was out-of-pocket spending, $492 was for private spending, and $3,677 was public spending, which equated to 10.5% of the gross domestic product for Germany. The OECD countries that were looked at for the study, the median spent per capita per person was $3,661. Of that, $625 was for out-of-pocket expenses, $181 was on the private spending, and $2,598 was on public spending. For healthcare spending expenditures per capita by source of funding in this graph, as you can see, the public spending for Germany, Canada, and the United States was about the same as the median. The U.S. spending was about $1,000 more per person. In the private spending arena, as you can see, the median was $181 per person. Germany and Canada had about 2 times as much as the median, and the United States private spending was way above everybody else. The out-of-pocket expenditures were about the same across the board. There was some variation, but not to the extent of the private spending and the public spending. Prescription medications was another area that I looked at and based these on also the OECD countries that were in the study, the median of those. For the United States, for pharmaceutical use, 61% of the adults take at least one prescription drug regularly, and 25% of the adult population takes at least 4 prescription drugs regularly. The per capita spending for pharmaceuticals based on 2008 data was $897 per person, which was 11.9% of the total healthcare spending. For Canada, 56% of the adults take at least one prescription drug regularly, and 17% of the adult population takes at least 4 prescription drugs regularly. Their pharmaceutical spending per person based on 2008 data was $701, which was 17.2% of the total healthcare spending. Germany has 54% of the adult population that take at least one prescription drug regularly, and 12% of the adults take at least 4 prescription drugs regularly. Their pharmaceutical spending per capita was $563, which was 15.1% of the total healthcare spending. The median for pharmaceutical use was 54% of the adults take at least one prescription drug regularly, and 17% of the adults take at least 4 prescription drugs regularly. The pharmaceutical spending per capita was $461, which was 11.9% of the total healthcare spending. In the pharmaceutical spending arena, the U.S. has the highest per capita at $897, but they have the lowest percentage of healthcare, of the total healthcare spending, which is only because their prescription medication, their healthcare spending was way more per capita than Canada or Germany, just based on the total dollars that was spent. And you can look at this graph, which shows the percentage of the adults that take at least one prescription, and those percentages that take at least 4 prescriptions regularly. In the area of disease management, the data that I looked at was hospital admissions for chronic diseases per 100,000 population in those aged 15 and older. The 3 most common chronic diseases that are treated across each country are asthma, COPD, CHF, which is congestive heart failure, and hypertension, which is high blood pressure. Based on the numbers, the U.S. has a high number of hospital admissions per 100,000 in the area of congestive heart failure, and so does Germany. Germany also has a high number of COPD patients and a greater than average number of patients that have hypertension that get admitted to the hospital. The US and Canada do a fairly good job of keeping their patients out of the hospitals and managing the chronic diseases for hypertension. Canada does an awesome job, and so does Germany, in chronic disease management for asthma. They have a very low number, even compared to the median countries. So there are some improvements that could be made in each, and each has their own area of expertise as to which population they manage their chronic diseases the best for. In the area of healthcare coverage, I ranked Germany first, Canada second, and the United States third. That was based on the numbers compared to the median numbers for the total healthcare spending for each country. I based Germany first because they had a little more per capita spending, but their total gross domestic product was only 10.5% based on their total spending, and their private spending was less than the private spending of both Canada and the United States. Canada was based second just because of their gross domestic product, and their private spending was a little bit more. I guess you could kind of say that Canada and Germany would be, if there could be a ranking of the same, Germany and Canada are kind of in the same area. The United States lags way behind, of course, and got ranked third in the area of total health care spending, as we spend a little over $9,000 per capita, and that's 17.1% of our gross domestic product. So we spend way more for health care, and our outcomes are not that much better than any of the other countries. In the area of prescription medication, I ranked Germany first, Canada second, and the United States third. And this was based again against the median countries that were looked at. Germany got ranked first as they had again, Germany and Canada could be ranked around in the same area, as their pharmaceutical use per patients, their percentage was about the same as well. But Germany got their ranking of 1 as their per capita pharmaceutical spending was $563 per person, whereas Canada was $701 per person. Again, the United States lagged behind, as we spend almost $900 per person per capita, and we have a great percentage of those adults that are taking at least one medication, and a great percentage of those that are taking two medications. In the area of disease management, I ranked Canada first, the United States second, and Germany third. Germany had a great number of hospital admissions per 1,000 population for ages 15 and older in the areas of COPD, congestive heart failure, and hypertension. The United States was second because, again, they did have a higher number of those being treated for asthma, COPD, and congestive heart failure. Not quite as many as Germany. The U.S. did better in the area of hypertension, but did way worse in the area of treating those patients with asthma. Canada got ranked first because they do an excellent job in preventative maintenance for their citizens to keep them out of the hospital. Their admission rates were way below even the median countries for their disease management. So I would say that Canada does an excellent job of disease management in those four areas. My recommendations for the U.S. healthcare to help would be to revamp the current state of the healthcare coverage. We still have quite a few citizens in the United States that do not have health care coverage. Even though we have Obamacare, they still cannot afford the premiums to have health care insurance. And there are those that do not qualify for public. They can't afford the public, or they can't afford the private, and the public insurance they do not qualify for. So of course they fall through the cracks, and those are the ones that end up being admitted to the hospital and spending thousands of dollars on them, as they do not have a caregiver that they can go to for disease preventative maintenance. Another area to look at would be to control the prescription drug prices. There are generics out there. Kind of make sure that the physicians are using those generics when appropriate, and not automatically sticking the patients on the latest and greatest that comes out. Generics do work very well. That should be a first line of prescription writing for those patients. We also need to make greater strides in the area of some of the diseases for chronic diseases such as congestive heart failure. The U.S. is far behind Germany and Canada in keeping patients out of the hospital that have congestive heart failure. We need to look at what we can do to keep those patients out of the hospital, or if they are in the hospital, to treat them more appropriately to get them out of the hospital quicker.